join us. I'm Cynthia Osborne, and I have the privilege of directing the Prenatal-to-3 Policy Impact Center. And we are a research center at Vanderbilt University, and our whole purpose is to be a resource for states to help you meet the goals that you have, helping all children thrive from the start. And we have had the opportunity to work with many of you already. And this is really an orientation to the types of services that we can provide to help you as each of you works to develop and enact and implement a paid family medical leave program in your state. Each of you is funded with some support from the Pritzker Children's Initiative. They've funded us along with the National Collaborative of Infants and Toddlers and several other organizations to be a support for you in these endeavors. And we want to make sure that you fully understand what we can do to support you, because each of the organizations is doing really amazing work and you have so many resources at your disposal, but we complement one another rather than duplicate. And so we wanted to make sure that you know really what that looks like. All right, I'm making sure that we are recording right now to just know that this will be recorded and that it is being recorded if you chat or whatever. Okay, so I think that most of you are familiar with our approach at the Policy Impact Center, but we focus on first what the conditions are that children need in order to thrive from the start. And everything we do is based on the science of the developing child that, tells us again and again how important those first 3 years of development are for lifelong health and well-being. And we review dozens and dozens of state policies to identify which policies have the strongest impact and the strongest evidence of that impact on improving the lives of infants and toddlers and their parents. And paid family medical leave is one of those evidence-based policies that we have identified, and it is on our annual roadmap. And our roadmap is really a way to illustrate how those policy goals align with each of the effective policies and strategies to help states really say, well, we want to make it so that families have sufficient resources or so that they can work and provide for their children and so forth. And that's what this roadmap does. And the paid family medical leave program is actually the policy that impacts more of the goals than any other policy. It impacts 7 out of our 8 policy goals. And it, not only makes it so that families are more likely to be able to access paid leave, it's one of the most pro-work policies that we have. It reduces poverty, it improves health and well-being of both the parents and the children. It allows the parents to bond with their children and allows the parents to engage in behaviors such as immunizations and breastfeeding that they want to do to promote optimal child well-being. All right, what we want to do today, though, is to provide you with an overview, like I said, of what is available to you as a state for free of what we can do to support you. And this document was included in the invitation, and I know we'll include it in the chat as well. But to make sure that, this is really a list of everything that's available and a link to many of the things that we have already done and created that we hope would be of use for you. And I want to think about, what we do here is we think about states and where they are in the policymaking process. And there are many of you who are just getting started. You're just deciding, how to build your coalition to inform and educate others about what paid family medical leave is. And you're kind of gathering that sort of information. And we have a lot for you that might be useful at that stage. One is just a review of the evidence, and we have various versions of this. If anyone wants to read, in depth the way that I have my students do, we have our clearinghouse version that goes through what the research says in depth about the impact that paid family medical leave has on outcomes for children and their parents. And then we have just kind of a short summary that might be a useful thing to include in coalition meeting packets, and then an even shorter research brief so that you can really understand what it is and why it matters. I also want to make sure that you've each visited our roadmap. Our roadmap has we call them profiles, but a profile for each of the 12 policies and strategies. And we answer a lot of questions there. So we go into detail about what it is. And paid family medical leave is an important program to describe because a lot of folks don't understand how it's funded, that it's a insurance program that families pay into and then receive benefits when they need it. But we're able to really help folks understand what it is and what the difference between bonding leave and medical leave and family leave is and so forth. We summarize the evidence so that you have a quick snapshot of the impact of paid leave on outcomes for infants and toddlers and their parents, or mostly at this point, just the evidence is on infants and parents. We also show you what states have done in terms of introducing legislation, enacting legislation, implementing the policy. And as I've said again and again, if you've seen one state's paid family medical leave program, you've seen one state's paid family medical leave program. There is so much variation across the country in terms of the length of leave, the generosity of the wage replacement level, who's eligible. And we go into detail of all of that sort of information. We also have a summary of what your state is doing. So for every state, we would have a quick summary so that you can share where you are in the paid family medical leave policy adoption process. We have other resources that are helpful in this earlier stages. Often you're trying to engage chambers of commerce or business leaders, and we have a nice memo that helps to really outline what the case is that for businesses and why it is that businesses do largely support paid family medical leave programs. And we also help to illustrate how paid family medical leave is funded. Now, that varies quite considerably across the country, but they all follow, like I said, a similar pattern in that employers and or employees contribute a small percentage of their payroll each month and then are able to draw on those contributions when they need to take leave for either birth, adoption, or fostering a child, for their own health, or for the health to care for a family member. So for those, we just want to make sure throughout that you know that you can contact us with any sorts of questions that you have. What states are doing this, or how are states doing this? You have a direct line to us. Jenny Palmer is now our senior state relations manager, and or state relations manager, or she just had a brand new title and a promotion, and she's wonderful. Reach out to her, and she will get any question that you have answered by our team. Many of you then move to this next stage. You kind of got your coalition, you know that you are ready to move forward with this, and you have to start to make some sort of decisions about what is your paid family medical leave program actually going to look like in your state. And we've developed this state policy lever checklist that helps you to walk through each of the decisions that you're going to have to make. Things like who's eligible, how long is the leave, what is the value of the wage replacement, how much is it going to cost to fund it, how will we fund it, and so forth. And it also helps you to think about some of the decisions that you want to make of whether your policy is designed to help those with the lowest levels of income to be more inclusive of all workers or limited to certain type of workers. So it helps you to navigate all of those important first principles that each of you is considering as you design your policy. So we invite you to look at that, and I'm happy to always walk through that with you. We also provide information to help you to determine some of these by helping you to understand what they cost. So we can work with you on using the Department of Labor's cost estimator, where you may have several different sorts of bills that you're considering of what you actually want to do. And we would be able to walk you through and show you what the different costs would be in terms of the benefits that would be paid out, the administrative costs, the reserves that you would need. And that helps inform what the value of the premium is that you would need to collect. So this just kind of walks you through all of these different scenarios, and we can create this for you and walk you through it, with your coalition, with your team, with your elected officials, whoever this information might be most useful to help you to really make those decisions about your policy, all the policy levers. And somewhere in between getting started and kind of getting going, we would be happy to come and talk with your coalition. We can talk with you about specifics, or we can talk to you broadly. This is a photo of one that we did in Ohio last year. I'm sorry, time has gone by so fast. I can't even remember which month it is at this time that we did this. But Abby Westbrook, who is the executive director of Collaborate Cleveland and who is helping to spearhead the coalition in Ohio around paid family medical leave, invited us to come and share. And she's here with us this afternoon to share with you all about how she used our resources and kind of got started on where they are in Ohio on their program. So I'm going to stop here and turn it over to her to share with you, and I will come back and share a little bit more about what the resources that we can provide. So I'm going to stop sharing so they can actually see you a little bit more, Abby, although let's see, maybe once you start talking, it'll come up.
Hi, everyone. Abby Westbrook here from Collaborate Cleveland in Ohio. I'm really delighted to be here. Wanted to share a little bit about how our coalition kind of got started and our partnership with the Policy Impact Center. So paid leave in Ohio has really started on the local level. All of the major cities and some of the mid-sized cities in Ohio have worked kind of independently of each other with some resourcing and support amongst cities to pass paid leave for the public workforce in each city. And as that work was happening and that momentum was building, there was an interest in exploring paid leave at the state level. But everybody was kind of like, how do we start this? How do we get this going? And our organization, in collaboration with an organization in Cincinnati and an organization in Columbus, started thinking through what are the steps we need to take to really start the exploration to advance paid leave at the state level. And we talked with a lot of other states. We talked with some key folks in Ohio about what were the steps we needed to take. And the thing that we heard over and over is really how to bring the coalition together and what is the starting point of that. And so in September of 24, we had been in conversation with the Policy Impact Center about doing a mini policy academy. And the way we thought about this wasn't a paid leave 101. It was by invite only. We invited about 45 organizations from across the state who had either paid leave in their policy agenda or adjacent to their policy agenda, who understood kind of the basics of a policy, but really wanted to go deeper in understanding how does a policy work at the state level? What are other states doing? What has worked? What hasn't worked? And so in September of last year, we had the Ohio Paid Leave Policy Academy in Columbus. We brought together about 45 attendees, and we had a day-long session where we kicked off with, why are we here? And then Cynthia did an amazing presentation that morning about what is paid leave? How does it work at the state level? What are the different policy levers? How do you think about structuring a policy? And it really provided a great opportunity for everybody to start at the same starting line. We all had the same information. It was research-based. And the Policy Impact Center also had a vantage point from across the US, which was also really helpful. So we did that in the morning for the Policy Academy. And then in the afternoon, we had invited two advocates, one from Pennsylvania and one from Colorado, to come talk about how they're doing their work. In Ohio, we were really interested in Colorado because they did ultimately pass paid leave through a ballot measure. And that is something that we want to consider here in Ohio. And so having their experience was really valuable to our kind of thinking on how we're going to do this. And then Pennsylvania, because their politics reflect Ohio's politics. And so really having the experience of Pennsylvania. And both of those introductions were made through the Policy Impact Center. And so we had two advocates come in the afternoon and really get into how do you do this? What the policy is, why you want to do it, but how do you get this done? And that was also extremely valuable. I think those two things together in a day-long program really fired people up. We had planned on doing this, and then we had planned on taking the rest of the fall to really think about how are we going to build the coalition, how are we going to do this. And from that event, people were ready to go. We had 45 people in that room who were let's get started on this now. We are all committed to this. We want to do this. And so, while it wasn't our plan to launch the coalition that day, the Policy Academy really was the jumping off point. And from there, 6 months, 5 months later, we have a coalition of probably 50 or plus organizations from across the state who represent maternal and infant health, labor, aging care, really across issue spectrum. And we are meeting monthly to really set the strategy for how we move this work forward. And so we are excited to go. And I will stop there. And Cynthia, let me know if there's anything else that you think's worth hitting on.
Well, I think that was really helpful. And I appreciate you sharing all of that. And, I don't know if you wanted to share kind of where you are now, if you guys have decided on some policy parameters or how you're kind of going about that. I know that you've spoken about some of the first principles of who are we doing this for. I was just wondering if you wanted to share a little bit more about how you're coming up with some of those decisions.
So one of the things we really heard from both the advocates in Colorado and Pennsylvania is really having a shared set of values and a baseline as a coalition. This work is not going to be linear. It's not going to be easy. And really understanding why we're all showing up for this work and what are our non-negotiables, right? And so we started our coalition work coming out of the Policy Academy, and we started as a coalition really defining our values. What are our values? Why are we doing this work? And what matters most to us in this work? And so and I'm happy to share with folks if it's helpful, send around our coalition values and our guiding principles. That is really the baseline for our strategy and how we will make decisions along the way. The other thing we did is we realized, we have 50 plus organizations and we can't make every decision with 50 plus organizations. And so we formed a steering committee of a few groups from that 50 plus coalition who are really helping to set the strategy, helping to make the decisions. Collaborate Cleveland is the anchor organization, so we are housing this work, but we are not the sole decision makers in this work. And that group, the steering committee came together for their first meeting in January, and we had a day-long meeting. And we had kind of the chart that you showed, Cynthia, of like, here are all the decision points. And we talked about it as a group of, what is our dream and what is our like baseline. And so from there, we're starting to really think about what does this policy look like, with the hopes of potentially introducing legislation in the fall of this year.
That's really exciting. And obviously we're still here. So when you guys have some of those policy parameters, we can help you with at least the first draft of a cost. And Jen from Alaska can talk more about that. But, having an actuarial report is always a good thing to have at the state, but we can help you to at least understand what the ballpark is.
Yeah.
And
Yeah.
so
Right now, we lean on the one you did for Pennsylvania just to use in our conversations, but having an Ohio-specific one would be really helpful.
yeah, absolutely.
Yep.
Well, more to come, but thank you for that. And we'll come back in just a few more minutes after for Q&A from all folks. Okay, I'm going to share a bit more then about what we can do for you, because there are some states that you've already determined what the policy is that you would like to get across the finish line. And you're trying to make the case for it. You are working with elected officials, you may have sponsors, but you have to, continue to push. And we wanted to provide you with some of the information of what we can do for you in this case. This graphic to me is like, something I want on my wall. I realize this isn't the most interesting thing for everyone in the world, but this is really where our comparative advantage is working with data. We have an amazing data team who has learned how to replicate these sorts of analyses for states, and we can do it in a pretty short period of time. And what this really is we would obviously walk you through this and provide you with information about how to share it and talk about it and so forth. But this sort of analysis allows you to really start to understand what would the actual benefit be for families in our state if we made a paid family medical leave program that had a wage replacement level of, I'm just making this up, 80% for those with lowest levels of income and 60% for those with higher levels of income. And we have to set a maximum benefit, and we have to determine, when things start to, when that percentage drops and so forth. Not all of you are at that stage, but you will be there. And we are happy to help to really graph out for you what that would look like, how much wages would be replaced, what would an individual's benefit look like at various levels of income, so that you can also see whether what you're doing is aligned with the principles and values that you have of who you're doing this for, and how it will benefit everyone. Another resource that we can provide for you is a benefit cost analysis. A benefit cost analysis is really a way for you to illustrate to individuals what the benefits of the program look like relative to how much the program will cost. And we have done this now for several states. This is an example of one that we did for Pennsylvania's proposed program. And remember that these programs are basically cost neutral to the state. The states collect a premium that cover all of the benefits that they'll pay out to families, as well as all of their administrative costs. But those are dollars kind of going out. But if you also think about what the state is collecting, what is going to see in reduced like cost avoidance for health care and other sorts of care for infants, the increases that you'll see in sales taxes and income taxes, that you really start to see, what the benefits are back to the state each year from a program. And we can show you what they are for a family. And we can also show you what the lifetime benefits would look like from reduced neonatal infant mortality, from increases in immunizations. All of these things have long-term benefits across the life course. And so these, what we're showing you here, are annual returns, but we can also show you the larger returns. And these have proven to be really helpful in making the case for why a state should adopt this program. And like I said, we've done these for several different states, and the benefits vary based on the generosity of the program, the number of babies born, and lots of different things. But all of it is done on your state and using your state's data. And we can turn these around pretty quickly for you. But the more lead time we have, the more that we can, kind of really do it well and get it to you in a way that it would be shareable with others. We can also do things like data simulations. Many of you may be familiar with our policy impact calculator, where we show how state policy choices impact the resources that a family has to provide for their children. We use Lena as our kind of stylized mom of 2 kids and show how, combined with the state's minimum wage, paid family medical leave, out-of-pocket childcare expenses, nutrition benefits, and all of the state and federal tax credits, what it looks like for a family in terms of annual resources. And paid family medical leave can really make a difference because it protects 3 months of a parent's salary for the most part, depending on the number of weeks that the program is introduced. And so can show you what that actually looks like for families at different income levels as well. We can also show you different simulations in terms of, for any individual, what their return on investment would look like. So if you take a worker who is making kind of the median household income, and you think this is someone who starts when they're working at 25 and works for 40 years until they retire, this just stylized over that time, they will pay in to the paid family medical leave program in Pennsylvania, in this example, just over $9,000. But if over that 40-year period, they also have 2 babies and they take the full benefit of what, based on what they're eligible for, they would have nearly $18,000 in benefits returned to them. So it's a 2-to-1 investment. On average, people have about 2 kids, and they're going to need about 2 instances of leave related to either their health or the health of a loved one. And so that's the case study number 2. Over the course of your full career, again, you're going to pay in around $9,200. But in this case, every individual who has this scenario, 2 kids and 2 medical leaves, would have over $35,000 in benefits returned to them. And then we also show it for an older worker who is past childbearing ages. But we can do these sorts of scenarios for you. And again, we work closely with you to determine what's most useful for you. All right, I'm now going to turn it over to Jen Griffiths, who is the Vice President of Policy and Advocacy at Alaska Children's Trust. And Alaska has been working very hard to introduce and enact a paid family medical leave program. They've made lots of different iterations of this. And the Children's Trust has really been a leader in the state of working with the coalition. And we've been excited to be able to support them in some ways. And so we've invited Jen to share with you some examples of how we've helped them that might be useful for you, and to just let you know where Alaska is in their whole effort. So I'm going to stop sharing. And Jen, welcome, and thank you for joining us today. And we'd love to hear more about what's going on in Alaska.
Yeah, thanks so much, Cynthia. And thank you all for being here. I know how much effort it takes to join webinars these days. There's a lot going on. So it's great to see everybody. So yes, in Alaska, our journey has been really driven by legislative interest. So I think that definitely triggered us needing the data probably a little faster than it might have otherwise. And I'll tell a little bit more about that story. But what I will say, just to give you a highlight of where we are now, we have a bill that's in the final stages of drafting. I'm really anxious to see it because you never know what's going to happen when a bill gets drafted. And we are hoping that that bill will be introduced in both bodies, and that it will have time for at least one hearing in each body before the end of the session. And our session up here ends in mid-May. So we still have time. And we also have a friendly majorities in both bodies that we anticipate hearings will be able to happen. So we're excited about where we are in the process. I do want to talk a little bit about how the data that we were able to receive from Prenatal-to-3 helped us move forward in this process and kind of tell this story and really develop what in our initial conversations with legislators looks like really strong bipartisan support for this policy. So like I mentioned, our process was really driven by legislators. We had legislators that were very interested in this policy in 2023 and 2024. There was a bill during that session. That bill, the single bill, took on multiple iterations within the policy and kind of how it was going to be structured. It became very obvious that while there was a lot of interest, there really were a lot of questions and not a lot of agreement about how to move something forward, what it needed to look like, and how much it was going to cost. The final hearing for that bill was in one of the finance committees, and they just kept asking, where's the actuarial analysis? And the staff had really limited information that they could provide, and that created some real barriers for moving forward. So as we started heading into a new legislative session, we worked to we wanted to have a little bit more control of the narrative and a little more control of the process. We knew we had champions, but there were some shifts that were happening, and we felt like it was a good opportunity to kind of make sure that that our legislature was kind of getting some accurate information based on everything that was happening across the country. So we kind of started back just at the basics. We had a little bit of a coalition, but again, there were just a lot of questions. So we invited Cynthia to just present a virtual webinar for us last fall. Recorded that. We had people in attendance, including some legislators, and we just worked to create this foundation, make sure everybody was getting the same information about what the policy levers were, what was happening across the country and kind of where Alaska fit into that. From that, we were quickly able to kind of rework with a coalition, kind of get some things going with some partners that had already been interested and were kind of watching what legislators were doing. But we also knew we needed to pull in our legislators. So those were kind of happening at the same time, developing those legislative champions and working with the coalition. We knew because of the movement this bill had 2 years ago, legislators weren't going to sit and wait for a coalition to make decisions. They were ready to move forward. So one of the first things that we did at the beginning of the session is requested this cost modeling from Prenatal-to-3. We didn't know what the policy was going to look like yet, and that's kind of why I was hesitant to even ask for it. But I was very excited to discover in conversations that we were able to put in some different parameters, different number of weeks of leave, different percentages for wage replacement, and ended up with 3 different examples of what this policy would look like in Alaska and what the contributions would be. From that, we were able to really use that information both with stakeholders, coalition members, and then other businesses. We've started having some initial conversations on that front, and we were able to use it with legislators during our legislative visits. So I'm going to share just a little bit about how we shared it and then what the impact was. One of the things that I was nervous about, this cost analysis is amazing, but it has a lot of information. And like I said, we had friendly coalition supporters, but we also wanted to start sharing it with other stakeholders. We knew just because of Alaska in our context, if we did too much work that was not transparent and we weren't talking to the right people, we would have some struggles being able to move a policy forward. So we needed to have some conversations with people that might be skeptical. But I didn't want to share the document because there's a lot of information in it. And like I said, we didn't have firm policy levers decided for our number of weeks or any of that information. So I was able to take the information from the document and create a PowerPoint that we held a couple of meetings. We walked stakeholders through the analysis utilizing that PowerPoint. It was really helpful. They asked some great questions. It kind of helped, we took some of their information back and it helped kind of create, to the coalition, helped create a little bit more structure around the parameters that we were looking at. But I really appreciated that I was able to use that information without putting all of it out there. So that's something to flag. The second thing I'll say is we use this document for our legislative visits. And again, we didn't share the entire document. We used talking points. So I was able to, with some of our more friendly legislators, was really able to use this document to demonstrate how the policy levers that they choose, how the generosity of this policy was going to be reflected in the wage contributions. That was helpful, especially for legislators that maybe aren't familiar with these types of mechanisms. So it was a really concrete way to just give them a couple of examples of how shifting the number of weeks might impact what the wage contribution would be. The second thing that was really helpful was it gave us a general range for cost. We were really careful, again, because we don't know exactly what the policy is going to be, what this bill is going to look like. We know kind of what we would recommend. And so as a coalition, so we shared kind of within those parameters. This is about what this would be. This is the cost that you're looking at. And we were able to compare it to some other things related. We've had a lot of conversation in Alaska about our unemployment insurance mechanism. So we were able to compare it to those contributions and kind of how that program works, because that's something legislators were hearing about. And then the last thing that was really helpful is we were able to tell a relatable story about how this policy would impact moms and dads and families in Alaska. So we utilized the household simulation. We talked about how much a mom would pay in. We talked about what the benefit would be to that mom in that year that she took maternity leave. I used the least generous models to have those conversations, just to even demonstrate the impact. Because the way we're looking at it is, even if we get the right mechanisms, even if we start with a less generous model, if we're at our floor, it gives us something to work for. The understanding that legislators had in seeing the limited amount that would be paid and the high amount of benefit for those families was remarkable. It was that really started to develop that bipartisan awareness and support for this policy, because they could kind of get a picture. It made it more concrete for them. So that's where we are. We've had those initial conversations. I feel like everybody's primed for this bill. We'll see what happens in the next few weeks. And I definitely have on my list, when we get a bill, to reach back out to Prenatal-to-3 to update some of this data, because it's been very helpful.
Jen, that just makes me so happy to hear. One, that's what we want to do, is to be useful, but we just learn so much from, you, Abby, other so smart advocates of how you can use information. And we've gotten some feedback from other states at times that, can you make it more like this, or can you make it more like this? And obviously we can't ever say anything that's not accurate, but we can make it clearer or simpler or other sorts of things. And so your feedback and learning how you use it is always just so helpful, and I really appreciate that. And we're definitely here for you once you want us to kind of analyze a final bill for you, or find the final parameters. So I want to make sure that we have a little time. You can, for our panelists, can use either the chat or the Q&A function, I believe. And just as a reminder that all of the resources that I have mentioned are either available on the kind of state services resources handout that was already mailed to you and will be mailed to you again. So all the links are there. And we will make sure that you have Jenny's direct contact from our team so that you can begin conversations. There's no conversation that's too small or too big to ask. And if we can't do it in a timely way for you right now, we will let you know. But we are, this is what we're here for, is to provide you with support. We do this for other policies as well. So for those folks interested in tax credits or your child care subsidies, other sorts of things. But most of these coalitions, you guys are really prioritizing paid leave right now, and that's what we're here to help you with. Okay, any other questions before we move on? I'm just making sure I don't see anything come up. Okay. Well, what we have planned is that we're going to put into the chat 2 different links. And basically, we're opening up this time for anyone who wants to join us for, we're calling it office hours, but for it'd be about a half hour of time in which you can meet directly with someone from our team to begin to ask some of the questions that you have, or say, I'm not sure what sort of help I might want, and what might be possible. And so we will have, many of you already have worked with Sarah Ritter from our team. She'll be in one of those breakout groups, if we can make sure to put that link in. And she, is the one that you want to go to if you're more in those earlier stages of coalition building, figuring out how to make the case and so forth. And if you're interested more in what sort of specific data analysis we can do for you within your state using your state's data, then I suggest that you join our data director, Alex Harrell-Amputis, and she will be in the other breakout room. Jenny and I will kind of go back and forth, but we wanted to make it so there's a place for you to go, and that conversation will not be recorded. It will just be opportunity for you to begin the conversations with us and for us to help you in any way that we can. Before we go there, I just want to make sure that there's no one who has kind of a larger question or a question for either of our guests, Abby or Jen. And Abby, would it be fair to say that that they can request, should they request directly to you the document that you suggested about the principles and so forth?
Yeah, I can put my email in the chat.
Okay, that would be
And feel
fantastic.
free to reach out to me.
Yeah.
The one other thing just to say that I didn't mention is, in addition to this, we did a poll as well in Ohio.
Right. Yes.
And we recently did that. And so if people have questions about that, or if it'd be helpful I'm happy to share what we learned in Ohio from that polling. So I just put my email in the chat and feel free to reach out.
Great. Yeah. I mean, I think that watching how states learn from and share with each other is, so important, because this peer-to-peer learning is really how it all happens. Jen, thank you for sharing your information as well. Okay, last chance for a question to either of our guests or to the full group. Okay, well, I can't thank you enough, both Abby and Jen, for taking the time and sharing, what it is that you have been doing, and to provide some examples of how we can be helpful. Again, to those that are getting support from Pritzker and the National Collaborative, there are a lot of great organizations that are doing a lot of amazing work, and use all of us. We're a little bit different because we are, really there to provide you with the evidence and the data analysis specifically for your state. And just happy to help you, and really hope that you will reach out.